Good day. I'm going to just give an overview of an article we recently published in the African Journal of Primary Health Care and Family Medicine. The title of the article is Climate Change and Health Within the South African Context, a Thematic Content Analysis Study of Climate Change and Health Expert Interviews. This study was commissioned by the South African National Department of Health, as well as the South African National Department of Forestry, Fisheries and the Environment, funded by the German Development Corporation, in response to climate change in the health sector, basically how to address it. The need for climate change and health assessments in South Africa gained significance in the context of the South African National Climate Change Adaptation Strategy, established in 2010 as part of the UN Framework Convention on Climate Change, CAN Adaptation Framework. This project is unique in that it's the first in South Africa that focuses on climate change and health, and it is being used to inform government practice, policy, and a draft climate change and health risk and vulnerability assessment framework. The broader scoping exercise involved a desktop scoping review as well as the RBA framework, which is currently being refined through a successive phase of the project in consultation with district health managers and local communities. This article, however, only focuses on the findings of the expert interview analyses, how it specifically relates to practice and policy recommendations, and how it broadly informs the development of the draft Climate Change and Health RBA framework. So this study was conducted specifically in South Africa. The University of South Africa led the scoping project in consultation with researchers and academics from the Council for Scientific and Industrial Research, or CSIR, Africa Health Placements, which is a not-for-profit organization, CNRS in France, specifically the DESE laboratory at Le Havre University, then as well as the Maastricht Sustainability Institute at Maastricht University, the Netherlands. 20 key expert interviews were conducted with South African experts in the field of climate change and health. Experts came from various sectors such as government, academia, grassroots advocacy, consultancy and research. The experts were selected specifically with consultation from the National Department of Health. So all the interviews were recorded and transcribed with the assistance of Otter.ai software. The data was then analysed by the researchers from UNISA and CSIR by means of thematic content analysis with the assistance of Atlas TI software. We also strove to validate interpretations, and we did this by taking a subset of the preliminary findings to the participants. We also held a stakeholder workshop in January 2021, where we essentially presented the preliminary findings and then enriched it and substantiated the analyses by means of discussions with the key stakeholders. The two international experts on the study, Pim Martens and Arnaud Banos, respectively from the Maastricht University and CNRS in France, offered the expert input for the broad deliverables of the project, and also specifically with the quality assurance of the study findings. So the findings were quite broad because it was an exploratory study. Quite a number of thematic areas are touched on, which we discuss in depth in the article. For this presentation, I've tried to sum it up under key points. So essentially, poor communities are most at risk of the impacts of climate change upon health, as well as those with underlying medical conditions. Climate change may also serve as a catalyst for improving the healthcare system overall and may serve as a conduit to do so. A draft climate change and health RBA should take into account existing frameworks and should be implemented by local government. It is also critical that the health and health system impacts from climate change are well understood, which necessitates essentially further robust research, which is still lacking in South Africa. So we urgently need to drive that, especially in light of the plans to implement the South African National Health Insurance, or NHI scheme. I've also just included a graph here. It's not included in the actual article, but this is just to give an idea of the distribution of physicians worldwide, and you'll see how sorely lacking the African content is, and African and small island nations are predicted to be the areas globally that will be most impacted by climate change. So we're sitting with an extreme situation within South Africa and within the African context that we really need to address and focus on. So what are the implications? So the main overall encompassing implications of the study is that consideration is to be given to form a South African National Department of Climate Change, or a similar coordinating body between the various national departments in South Africa, as health intersects with all the other domains within the climate change field. So I hope this brief overview provides with a interest to further read the article, and also to advance further study in this area and policy recommendations and implementation at a grassroots level. Thank you.